Hello, everyone. Uh, Good morning, good afternoon, good evening, wherever you are. And as we understand, we've got a good number of participants joining us today from all parts of the globe. Uh, should we wait for a couple of minutes or we go ahead?
You can go ahead, Prof.
All right. Okay. Thank you so much. So, meanwhile, the participants keep joining. I would like to extend a very warm welcome to all of our distinguished participants joining us from across the Eastern Mediterranean region and much beyond. On behalf of AmpNet and the 717 Alliance, I'm honored to moderate today's webinar titled Accelerating Outbreak Detection, Notification and Response in the EMR, Advocating for the 717 Approach. As most of you are familiar, delays in detecting, reporting, and responding to outbreak remains a persistent challenge. The 717 approach detects within 7 days, notify 1 day, and complete early response within 7 days. Provides a simple, evidence-based performance target to strengthen the outbreak preparedness and response system. And since launching, we've been watching, since launching, the concept in itself has become viral in a very short time. It has gained a lot of momentum across the globe. I have had the honor of bringing it to my own country, Pakistan, and then persuading the regional level. And I'm sure we will be benefiting much more as we move on. Now, ladies and gentlemen, today's session aims to orient EMR stakeholders to technical foundation and the relevance of 717 approach, showcase experiences from Pakistan and other regions to highlight feasibility and lesson learned, provide a roadmap for countries to begin implementation aligned with existing health security framework. We are privileged to have with us a distinguished panel of experts. Together, they will share valuable insight and practical guidance to help accelerate outbreak detection and response capacities in the region. Now, some of the housekeeping rules: the speaker will be having 8 to 10 minutes for their presentations, and we will be having a detailed question and answer session after that. And you are most welcome to put your questions during the presentation to the pertinent speaker inbox if you require. Now, as we move on, again, I would like to invite my first very honorable speaker, Dr. Amjad Al-Kholi, who is a medical epidemiologist and team lead at WHO Eastern Mediterranean Region Office, where he steered the work on IHR monitoring, evaluation, and preparedness. With over 25 years of experience, he has supported countries in strengthening health security and response to major outbreaks, including COVID. He has played a pivotal role in building, expanding influenza and viral respiratory diseases surveillance system across the region, significantly enhancing the regional capacity to detect and respond to high-threat pathogens. And today, he would be talking about from signals to action, accelerating detection, notification, and response in the EMR. Over to you, Dr. Amjad.
Thanks so much, Prof. Amir. I hope you can see my screen. I tried to just put it in screen mode. Can you see it in screen mode?
Yes, we can see. Thank you.
Okay. Okay. Thanks again. Good morning, good afternoon, colleagues. As Dr. Prof. Amir announced, my presentation will focus on how we can move from signal to action, and focusing, of course, about the situation in our region, Eastern Mediterranean region. In the beginning, we are living these days with a situation where the threat is so high of transmission of diseases, with easy movement from one country to another, with climate changes, with the conflict. All those factors increase the possibility to have high spread of infectious diseases, a high risk for all the countries to face public health threats in different ways. This make the enhancing the capacities in detection, notification, response is highly needed to ensure the national, regional, and the global security. Given that, I just want to show you a couple of examples of public health threats during just 25 years. All this just examples, but all those examples had their great impact on movement in economics and finance and social life. Of course, all of us still living on the experience of COVID pandemic, but COVID pandemic was just one example of those different public health threats. We can remember SARS, which hit the world 2002 up to 2004. We, of course, aware or heard about foot and mouth outbreak, which affect the trading and the economic of Europe and the different other countries. Influenza with different types of influenza. MERS, which affected also mainly our region, Middle East respiratory syndrome, with the focus or high concentrate of the cases in Gulf countries. I think all those just examples of what we are facing, and of course, in addition to what is called disease X or syndrome X, which is something, of course, we have to expect non-expected syndromes or events. This level of threats where we are living and surrounding all of us, but the world, the globe, in a big challenge. And therefore, many framework, many initiative, many action have been taken, including many guidelines, many guidance note, including International Health Regulation, IHR. This is the legal framework which aiming to ensure the country's capacities to prevent, detect, and respond to any public health event, and also to notify. Those the core element for IHR. Again, this long list of activities have been agreed global-wise, and those activities usually support the countries, the different nations to build their own capacities. Actually, in our region, we are in more threats. If we are talking about global threat everywhere, unfortunately, our region in much high situation, worse situation compared to others. There's just a couple of main challenges we are facing in our region. Of course, political instability and the conflict is represent the major one, and majority of the other factors resulting from such situation, political instability and conflict situation, security concern, refugee, financial issue, mass gathering, displacement. You can list and you can just mention any kind of threat, public health threat, and it's happened in our region. This result a very unique situation in our region. 13 member states out of 22 member states are directly or indirectly affected by conflict. 9 member states fragile or conflict affected situation. We have almost 1/5 of the population in our region are in need to assistance due to the emergency. So far, we have 19 graded emergency, 7 complex humanitarian emergency, and currently we have documented or announced 71 disease outbreak. They are ongoing so far in our region. In addition, of course, refugee and displacement, more than half of the displaced population and refugees in the world coming from our region. Of course, in addition to other global factors everywhere, climate changes, final crisis, and globalization. This put the WHO regional office in such a situation to take major action, support countries more, and emphasize on major issue, including assessing the and addressing the gaps for national preparedness, strengthening the capacities to prevent, prepare to, detect and respond to different emergency, and enhance the country capacities for early detection and for response, and in addition to that, of course, for recovery. For that, still WHO and WHO Emergency Department within WHO Regional Office EMRO is committed to support countries for saving life and minimize suffering of providing relief during emergencies, during crisis. Back to the IHR as one of the main document, and it's considered the only legal document addressing the public health threats and the transmission of the diseases and other events across the border. This version of IHR have been issued and approved 2005, and couple of addition and a couple of amendment have been conducted, but still the core will remain IHR 2005, and the core objective of it to support the countries to ensure their capacities to secure the public health capacities to prevent, detect, and respond to different events. And for that, within this legal framework, the framework make it like a requirement for all countries to build their capacities in surveillance, reporting, notification, verification, response, and collaboration with other countries. To ensure that, WHO's member state agreed to have kind of framework. We have so far 4 tools for monitoring and evaluation to ensure the countries are on the right track, to identify gaps, to address list of recommendations to improve the country's capacities. Those 4 tools are State Party Annual Report, which is the only mandatory tool, in addition to other 3 voluntary tools, including joint external evaluation, action reviews, and simulation exercise. When we see those tools, we found they are usually focusing on the 3 main pillars, which is prevent, detect, and response. But we have another bulk, or within this 4 tools, this action review, which include 3 subtypes or 3 tools to ensure the right response for any event. The first one, which is the oldest one, which is after action review, and then during COVID, there's another tool have been issued, which is inter action review, and recently this early action review. When you review the early action review, it's much linked and based on 717. So we are using 717 to ensure the early action review, the timeliness of early action review, and in addition to other factors related to the quality of the response. Back to our situation, and as we are aware about the self-assessment tool, which is the SPAR, the State Party Annual Report, there's a situation of our region. We can see most of the world are green, reach acceptable level of capacities, except mainly Africa and couple of countries in our region. In the Mediterranean region, there's a big variation between one country to another. We have some countries succeeded to achieve high score in this report and develop their capacities, while others are struggling, mainly because of the conflict situations, the fragile health system in our region. This results in such big variation. And all of us are aware about whenever there is any leakage or any weaknesses in the health system in any place in the world, still all the world will remain on risk. All of us remember COVID, how it started in a small city of Wuhan in China, and within just few weeks, it spread all over the world. So remain weak capacities in some countries will remain considered as risk for other countries. Anyhow, for the 15 technical areas covered by SPAR, there's a big variation from one country to another, while as an average, we reached 66% as preparedness index, as or the average or the mean of the scores from different countries. I will not take longer time, but I just want to end my presentation with what have been highlighted by the WHO Director General as there's a time to translate policy to action. All of us aiming to save life and protect the most vulnerable. Thanks, Prof. Amir, and thanks, colleagues, and much willing to receive your comments, your question. Thank you. Over to you, Prof. Amir.
Thank you so much, Dr. Amjad, for very comprehensive talk within a very short span of time. It's brilliant. Thank you so much. With that, ladies and gentlemen, we would like to move on to our next speaker, Dr. Dalia Samhori, who is a senior health professional with over 20 years of experience in health emergency management at the scientific, policy, managerial, and academic level. She holds a PhD in biomedical sciences with a major in global health from the University of Geneva, a master's degree in public health from Tulane University, US. And currently, she is the lead health specialist for Pandemic Fund, where she provides expert technical and programmatic guidance on funding proposals, aligning with the strategic priorities of the Pandemic Fund at national, regional, and global levels. Before that, she was the regional manager for health emergency preparedness and IHR at the WHO EMR. So today, she will be talking about utilization of 717 and monitoring and evaluation of pandemic fund projects. Over to you, Dr. Dalia.
Thank you so much, Dr. Amber. I'm trying to fix the camera. I don't know what happened. Give me a second. Let me know if you can see me or hear me. Okay, brilliant. Thank you. Thank you so much. And good morning, good afternoon, good evening, colleagues. It's really an honor to be with you all. Let me know if my voice comes clear. I have a lot of noise outside. I hope this does not distract or interrupt the sound. Am I clear? Dr. Amir?
Yes, please. You're loud and clear.
Okay.
Thank you so much.
Okay,
brilliant.
Very good. Thank you. Thank you so much. So today, it's true that I will be talking about the utilization of the 717 for the monitoring and evaluation of the Pandemic Fund projects or the projects that have been awarded by the Pandemic Fund. But given the fact that we have a great number of colleagues joining from different countries, I'll also use it as an opportunity to talk a little bit about the Pandemic Fund. And if you can move to the next slide, it's I'll make sure not to exceed the 10 minutes I have. This slide basically shows how the Pandemic Fund was established. Given the fact that we are still new, it's been about a couple of years since the inception of the Pandemic Fund, and I try to use different opportunities just to explain how this Pandemic Fund was established. And it's really because of the COVID. And basically, if we go back to the G20 meeting, and the G20 was the host of the different discussions related to the Pandemic Fund, but specifically coming out with a tool or a financing tool that would help countries to build their capacities for the preparedness. So the discussion started back in 2021, where during the G20 meeting, there was a decision to establish a joint health and finance task force. And this task force should take the responsibility of finding different or exploring options of how to establish a financial facility to support countries. 1 year or less than a year after that, which is April 2022, and again in the G20 meeting, it was decided at that time that and of course, through the discussion and the support from WHO and the World Bank, that the World Bank actually to explore the possibility of setting up a financial intermediary fund. Soon after that, which means exactly a couple of months, the World Bank board approved the establishment of this financial intermediary fund. And it was only a couple of months where the announcement about the Pandemic Fund took place, and the call for proposals for the first time also took place a couple of months after that. So as we speak, as of today, we do have a little over 2 billion in terms of finance that we managed to bring from the different donors. And so far, we managed to put in place about 800 million in terms of support of a project. And the third call is actually still ongoing in terms of the review of the proposals that were submitted. Next, please. So this is what we have at the moment. 47 proposals were supported, spanning 75 countries in the form of single, multi, or regional entity proposals. And as you can see, we are supporting countries, mainly the low and middle income countries. And the figures that you have basically shows the percentage of countries that are supported per region. But interestingly, that we have the supported projects, they're basically having at least 2 implementing entities. And if you don't know, we have 13 implementing entities. 2 more should be approved very soon. They're in the last phase of signing a specific agreement that would allow them to be an implementing entity. But also, one more thing to highlight is that when the mpox was highlighted as a public health emergency of international concern, that was an opportunity to accelerate a certain review process and to accelerate the providing of support for specific proposals that were recommended for approval. Next, please. Oh, and maybe just one last point on this slide. It's very important for us to highlight that the pandemic fund is not only a financing mechanism. So it's not only about the 885 million that we managed to allocate to countries through the first and second round. It's really about the importance of something that we call co-finance and co-investment, in a way that we are encouraging countries and regional entities to unlock resources, whether these are external resources or domestically available. And so far, if you can look into our leverage ratio, it's at least 7 times, which means that we managed to mobilize external resources and domestic resources in the form of 6.16 billion, which is a huge amount of money if you think of it. And that was because of the support from the pandemic fund. Next, please. So these are the countries that we've been supporting, different colors, different regions, but also single, multi-regional entity proposals. And if you go to the next slide, it's very important for us. It's not only to give money to countries and to make sure that other partners are able to mobilize resources. It's really to see an actual improvement in the preparedness capacities. And this comes to our main objective, which is providing dedicated support, which is additional funding for pandemic prevention, preparedness, and response. But at the same time, we do expect that capacities, and mainly related to IHR, are being improved. In order to be able to monitor this, we have our results framework, which you can see on the right side of the slide. And this result framework is focusing on 4 main result areas. One of them is focusing on capacities. The second one is focusing on the coordination among the 3 sectors, but also implementing entities. The third one is looking into mobilizing resources, whether domestically or additional external resources. And the fourth one is looking into the efficiency of the spending. And if we look into the 717 specifically, it's true that it's one of the tools that we are using and recommending countries and regional entities to use to monitor the improvement related to result area 1, but it can be easily come across the other result areas in a way that it has direct and indirect way of using it. So in addition to the result framework, where it's clearly, basically we are collecting the number of countries that are utilizing the 717 in the monitoring and evaluation. But at the same time, we do have a monitoring and evaluation guidelines, which are project specific. And in that, we include a number of input indicators, output indicators, and sometimes impact indicators related to the country or the regional entity, in a way that we try to collect more information about the ability to detect and early respond to outbreaks. And the 717 should be utilized properly in the monitoring and evaluation, or even in setting a monitoring and evaluation a proposal or project specific for the pandemic fund. Next, please. I should be finalizing my presentation soon. So just to highlight that it's true that we have a number of tools that have been highlighted for use to do the monitoring and evaluation. And a great example, echoing what Amjad mentioned at the beginning, that the IHR monitoring and evaluation framework is actually the framework that we are relying on, whether the JEE or the SPAR, in a way that it gives the quantitative information, or the intra-action reviews, after-action review simulation exercises, where they provide the qualitative information. But we know that both they work with a varied time frame. But it's very interesting here to note that to show progress in terms of building capacities, it really takes a long time. So sometimes when we're focusing on the GE and the SPAR, the progress across years usually is very limited. And I think one of the presentations that highlighted by Amjad, and if you look into the actual capacities at the moment, you can barely see a progress between years. I mean, you'll see, for example, if you look into the surveillance, maybe you can see it 80% this time. And if you look at it in the coming couple of years, you will also still find it as 80%. The 717 is a very practical exercise because it helps to understand the progress that is made in specific areas, and it helps the projects that are supported by the pandemic fund to show that there is real progress. And it's not necessarily in the form of the indicators related to GE and SPAR, but the information that comes are really quantitative and qualitative information that can be easily associated with the progress made on the project, but at the same time, it helped to direct discussions on how to prioritize investment, whether through changes on the projects that are funded by the pandemic fund or when submitting future projects to the pandemic fund. Next, please. So of course, we understand that there are certain limitations, but also opportunities when it comes to the 717, because I think the main problem is really the availability of data. And sometimes it's difficult to use it when it comes to some fragile settings. But at the same time, we don't want to create a parallel system that would facilitate the reporting. So it's important that this is seen as an integrated approach within the overall system that we have in countries. So, but at the same time, we see a lot of opportunities. So by using the 717, it's important that to have in the back of our minds that it would help decision-making when it comes to adjusting investment priorities. It's a very good tool to be used, but it helped to make a quick decision-making and bringing the different sectors together. And sometimes it also helped to do kind of comparison between countries, which is something that we don't prefer to do, but comparison might help, and particularly when we are having projects that are coming together involving a number of countries. Next, please, is the last key lessons that we have put in place by collecting information on the countries that have used the 717 in providing progress related to pandemic fund projects. It's very important that the 717 is really embedded within the national system, so we don't have a parallel system being created. So countries, they should take the ownership, accountability, of course, but this needs to be linked with the financing, but also other capacities related to workforce, related to surveillance, related to laboratories, and other elements that are considered with the initial response to any disease outbreak. This somehow will guarantee that it's integrated within the overall system, but at the same time, it will also guarantee the utilization of the tool beyond the time frame of the pandemic funded projects. I can talk more when we have the questions and answers, but let me move to the last two slides, where you can see links to the different documents to give you more details about the exact reference to the 717 within the results framework and within the monitoring and evaluation guidelines, but also our strategic plan that basically highlights the priority areas that we're focusing on and how and why, or justifies why the 717 should be used in the monitoring and evaluation. And then my last slide is additional links that you can use to look into the projects that have been funded so far, but also more information about the pandemic fund, the governance structure, the governing board, etc., etc. Thank you so much, and back to you, Dr. Amir.
Thank you so much, Dr. Dalia. That was really superb. And dear participants, you must be realizing that the presentation in order are supplementing, so it gives you much more clarity. And with that, we move on to our next speaker, Tyler Porth. Dr. Tyler is the Principal Technical Advisor for the 717 Alliance at Resolve to Save Life, bringing nearly 15 years of experience in the global health, data and analytics, epidemiology, and epidemic preparedness. In his role, he leads the strategy and technical support portfolio for the Eastern Mediterranean region, as well as the Asia-Pacific region. Previously, he served in various roles across the United Nations, where he focused on public health emergencies, data integration, and policy advisory. Tyler holds academic credential from Johns Hopkins Bloomberg School of Public Health and is a global champion for strengthening health security systems through his current role. Today, he would be talking about strengthening health security in the Eastern Mediterranean region with 717 as target, progress and opportunities. Over to you, Dr. Tyler.
Thank you, Dr. Amer. Marhaban Zumala. Assalamu alaikum, my colleagues. I'm going to share my screen here. We can get going. Fantastic. Well, I want to start today by extending a huge thank you to Infonet for the invitation to speak at today's webinar event. It's a real pleasure to be joining you all and be a part of this distinguished panel, and just to have the opportunity to talk about the 717 target and give an overview and discuss some of the opportunities that we see in the Eastern Mediterranean region. But I start with a question. What if every outbreak was an opportunity to learn and improve? This question has been the driving motivation behind 717. What if every time our systems were tested, we could quickly identify what worked well, what didn't, and act on that information to actually improve our health systems, sometimes in real time during that outbreak? This has been the core objective of 717. Now, I'm sure many of you have heard of 717. It's been discussed quite a bit over the global landscape over the last couple of years, but I know not everyone has a full understanding. So I'm going to start today with just sort of a very, very brief overview, but at the end of today's slides, I'll also direct you towards other resources where if you're interested to learn more, we have ample resources to guide you through that. 717 is a systems-based approach to improving the speed of outbreak detection, notification, and response systems. It relies on these three key steps. First, assessing the timeliness. How fast did the system do what it was supposed to do? The second is identifying bottlenecks. What worked well within the system, but also what didn't? And were there bottlenecks that slowed or inhibited the response? And then finally, take action. We don't want this to be just an assessment. So once we've identified bottlenecks, we want to propose corrective actions and act on them. We want to implement those actions. So in order to facilitate this, there is a simple set of timeliness metrics with corresponding targets that help countries in implementing areas to identify those bottlenecks, propose those actions, and improve their outbreak preparedness and response systems. This is what 717 is. The 717 approach includes these three timeliness metrics and targets. The first is time to detect. I think you can see my cursor here on the screen. So the first part of the 7 is time to detect. This refers to 7 days to identify a suspected public health threat. The second metric is time to notification. Here, the target is 1 day to inform the appropriate public health authorities. And the third metric is time to complete an early response. And the target here is 7 days to initiate an effective response. So here, the targets of 7 days to detect, 1 day to notify, and 7 days to complete the early response are what make up the 717 target. Now, in the interest of time, I won't go through this whole slide, but this is an example of a completed 717 assessment. You can see at the top, we have our targets: 7 days to detect, 1 day to notify, 7 days to respond. For this particular outbreak, we looked at when the disease emerged versus when it was detected, and realized it was 46 days to detect. So identified a bottleneck here. It was less than 1 day to notify. So once it was detected, it was notified that same day. So there were no bottlenecks for notification. But on response, we had 9 days from the date of notification to completing the early response activities. So here, the 717 target in reality was 4619. So we found bottlenecks around detection and response. And the team in this particular case went through and identified what the bottlenecks were at each of the various stages of this process. Also identified some enablers, because it's helpful to be able to build on things that you know are working well and some strengths of the system. And from that, we're able to propose both immediate and long-term actions. In this case, the immediate actions were able to be implemented during the ongoing outbreak, as this was used as an early action review, to improve the response to that outbreak while it was going, instead of waiting for it to continue to cause constraints in the system. So that is a very brief overview of what 717 is. Again, I know it's It's only surface level, and I will point you towards more resources if you're interested in learning more. But I also want to take some time to talk about the impact and scale that we're seeing now that many countries have begun adopting and using 717 regularly. So implementation in many countries has shown us examples of how regular 717 use can improve outbreak detection, notification, and response timelines. So this is an example of subsequent avian influenza outbreaks in Cambodia. When 2 districts had simultaneous outbreaks in early October, these are the first 2 bars here, it took around 1 month to complete the detection, notification, and response activities. You can see the 1st of October, this outbreak was 33 days. 2nd of October, this outbreak was 28 days. But both of these districts, and with the national support, conducted 7-1 assessments. They identified bottlenecks, in this case on the notification and response components of the system, and proposed and implemented actions to fix those. And when there was a subsequent outbreak 6 weeks later, it took only 6 days to complete these same activities that just a few weeks earlier had taken a month. And this time that we saved in this case is critical because we know that when it comes to outbreaks, time saves lives and it helps economies. So a limited but growing evidence, a body of evidence is starting to emerge that's showing the true impact of hitting the 717 target. So this modeled analysis from Burnett Institute, who compiled and analyzed a global database of historical vaccine-preventable disease outbreaks, assesses the impact of initiating the outbreak response immunization programs within 15 days. They chose 15 days because it aligns to the 7, 1, and 7. So 15 days to cover the full 717 timeframe. So this analysis, even though it had a narrow scope and was only looking at VPDs and was only specifically looking at the initiation of outbreak response immunization programs, still showed really incredible impact. And varying by the different types of diseases, we saw impacts ranging from up to 35, up to 45, even up to 80% of cases that could be averted if the 717 targets were fully hit in these cases. So now I mentioned the evidence that's coming from the countries that have been implementing. Another thing that we're learning from the countries who have been implementing over the last few years is 4 principles on how this can be used effectively. The first is that using 717 often for continuous performance improvement is the best approach. Using it regularly, using it often, and not, it's still valuable if you want to do sort of a retrospective review every 6 months, but it's much more valuable and much more impactful if you're doing this regularly on an ongoing basis when you have outbreaks occurring. Second is that 717 is intended as a learning opportunity, and it works best with non-punitive, honest, and transparent assessments. Though we often talk about the 717 target as a whole, each of the 717 intervals around detection, notification, and early response, each of them is essential. The earlier you use 717, the better your chance of calibrating the outbreak response. I mentioned the 2 examples earlier, one with the busy slide that showed the full 717 assessment, and the other was the avian influenza outbreak from Cambodia. In both of these cases, 717 was implemented as an early action review, and they took immediate actions and made immediate decisions that helped them to reduce the impact of that outbreak while it was ongoing. 717 flexibly integrates into existing systems and workflows, planning, and frameworks. My colleague Dahlia mentioned how integrating this into national systems is critical. And we know that national systems and how they're constructed and the infrastructure and governance varies substantially. And so 717 has been created as a simple and flexible tool to be able to adapt and integrate into a wide range of different systems. And finally, engaging a broad set of stakeholders is critical because 717 focuses on addressing a wide range of systemic bottlenecks. Some other key lessons that we've learned partnering with countries over the last couple of years is that reaching 717 is feasible for most outbreaks. In certain contexts, we understand that it's quite challenging and perhaps aspirational, but it's always something worth striving for. And we have found evidence that in the majority of cases, it is a feasible and realistic target. Having a champion is critical to support high-level buy-in and implementation. Surveillance and response actors must work together to fully achieve 717. And finally, several key bottlenecks can be fixed at little or no cost. We've had many examples that have emerged from countries of major challenges and major bottlenecks that have been mitigated just by making sure individuals have the right contact numbers or pre-approvals for the use of gasoline to be able to travel out to conduct outbreak investigations. So many of the bottlenecks can actually be fixed at little to no cost. So now I'm going to take a few minutes and talk about the 717 Alliance, who we are, what we do, and how we can potentially help. So the 717 Alliance Secretariat is hosted at Resolve to Save Lives. Our goal is to scale the adoption and use of 717 globally, to provide technical assistance and training. We engage partners in our community of practice and learning networks. We develop resources, tools, and other critical assets that are all hosted on our website. We generate evidence through operational research, and also we always want to use our communications and advocacy program to showcase the good practices that are emerging from the implementing countries. So the Alliance was launched back in 2023, and over the past 2.5 years, we've seen our community of partnering countries grow from 11 to around 66 right now, and it's a community that continues to grow each and every week, and we're very privileged to be a part of partnering with so many fantastic countries to see this continued global scale and uptake of 717 and the impact that it's having. But as 717 has continued to scale, it also creates new opportunities, including here in the Eastern Mediterranean region. So in the region, we're seeing strong and growing partnerships with key regional institutions like IMFANET, WHO IMRO, Gulf CDC, and several others. We're also seeing really strong regional implementation. We have the privilege today of hearing from our colleague Mashid from Pakistan, and we also have a partner in the Kingdom of Saudi Arabia. Each of these is showing really impressive examples of how implementation can happen, what adoption and use looks like, and the impact that can have. And I'm thrilled that we'll have the opportunity to hear from our colleagues in Pakistan today. But we're seeing beyond those two countries really significant interest and demand growing in this region from a wide range of countries. Our colleague Dalia has talked about the pandemic fund. It really seems to have been a driving force for interest in 717 in this region. She detailed really well the synergistic relationship that Pandemic Fund and 717 have, where 717 assessments can often illuminate the things that require additional investment and resources and support, often which Pandemic Fund can be a great tool and mechanism to support implementing those changes. But then 717 can also be used to assess the impact of those changes that you are attempting to make in countries and monitoring the impact that you're having through those investments. So the Pandemic Fund, I believe there's already 10 countries in the region that have either a single country or multi-country award recognition through rounds 1 and 2, and I know several other countries have submitted applications for round 3. So many of those creating additional opportunities to support 717 adoption and use here in the Eastern Mediterranean. And also within the Gulf states, there's a growing interest in 717 adoption, both at the country level, but as well as at the sub-regional level for the Gulf. Beyond Kingdom of Saudi Arabia, an additional 3 countries, at least that I'm aware of, have expressed interest in 717 adoption. And we're keen to work with all countries in the region to support the adoption and use moving forward. One thing that we've been doing, or a couple things we've been doing at the 717 Alliance to support the region with our resources and opportunities here in the future. One is through translated tools. So you see a couple of screenshots here on the right of the slide, but our entire 717 toolkit and all of the corresponding tools have been translated into Arabic. Those translations complement our others in Spanish, French, and Portuguese to try to make sure that our tools are all widely available to countries around the world, including here for Arabic speakers in the Eastern Mediterranean. We're also working on a plan to have all of our training curriculum fully translated into Arabic as well. So we hope to have that available over the course of the next couple of months. A couple weeks ago, we had a virtual training of trainers where we had the opportunity to work closely with WHO IMRO and IMFANET to continue to build the knowledge base and capabilities and capacity around 717 for our colleagues working directly with countries through these key regional institutions. And finally, we're working towards planning in Q4 of this year a regional workshop for the Eastern Mediterranean to do a deep dive for country teams who are interested around 717 implementers training and having an in-depth look at the materials and an opportunity to be trained and have capacity developed around the use of those to support adoption in a wide range of countries. We also recognize, as my colleague Dr. Amjad was saying at the beginning here, how diverse the region is. So we also want to work closely with countries to understand how we can tailor our approach and support countries, recognizing the diversity of humanitarian and conflict-affected settings to some countries with vast resourcing and ample capabilities, to see how we can adopt our approach to best support the countries in the region. So the resources that I mentioned are all available here on our website, 717alliance.org. You'll all likely have access to my email after this as well, and we encourage any emails to reach out for questions or where you see opportunities for implementation in your countries. And one shout out that I did want to give specifically to a resource is this brand new online self-paced learning course that we've just launched over the last few weeks. So if you're interested in learning more about 717, I know that I was, in the interest of time, gave only a sort of very peripheral overview of what it is, but if you're interested in a deeper dive, these 3 modules of our online course, I would highly recommend. They're self-paced, you can take them at your own time. This first one in particular provides a full overview and introduction to 717, including simulated outbreak scenarios where you can get hands-on practice using simulated exercises. And it takes about 3 hours on average to conduct the first one. And then if you want to go deeper, we have additional modules on how to use 717 and the steps for adopting 717. But with that, I will close my presentation, turn the mic back over to Dr. Amer, and say shukran and thank you to the colleagues on the call. Thank you.
Has progressed within a short span of time. And I think all credit to the team, the Alliance. Thank you so much for your presentation. Dear audience, I mean, we understand COVID was a huge challenge, but we truly believe such challenges do bring in opportunities, as pointed out by Tyler as well. And we need to turn these opportunities into implementable action, a strategy for the future. And as you heard about the pandemic fund, it is the outcome of that. As you hear about the 717, it's the outcome of it, just to save and having a better, healthier future. And I would also request, you heard another term, the champion. So please be the champions for 717. That's a great opportunity for all of you. And I understand you've got more than 200 participants online. So let you be the champions for 717 and definitely other modalities as well. Now, with that, I move on to our last speaker, Dr. Majid Ali Taher, basically Health Education Officer at Center for Disease Control, National Institute of Health, Pakistan. He provides support to IHR and FP in coordinating the implementation of activities, including the development and execution of National Action Health Plan for health security, supporting the strengthening of health emergency management system coordination of pandemic fund implementation, and the oversight of 717 adaptation and implementation. Today, he would be talking about adopting and implementing the 717 approach in Pakistan. Over to you, Dr. Dar.
Thank you very much, Dr. Amer, and thank you very much for introducing 717 approach to Pakistan and EMR region as well. And this is a great honor to see you here as you have done a lot for the regional and the national security. So this is an honor to have opportunity to share with you the journey of 717 implementation in Pakistan and how this approach shaping up. Am I audible?
Yes, you are. You are.
Okay,
Majid,
thank you.
yeah. There's something wrong. I'm sorry for interrupting you.
Okay, thank you very much.
If you can put off your camera, that would be good. That would be better for the audience, because there is the sound is not that clear, and get close to the computer. Thank you.
Okay, sure. Thank you, Dr. Amer. Actually, this is a very great honor for us to discuss our journey and progress of 717 implementation in Pakistan and
Sorry,
how
Majid, again stopping him. I'm deeply, extremely apologize for that. But there are echoes, and everyone, the participants are complaining. I hope there are no two different. Either your mobile is on with you can put it off and just use the computer. I think you're on two things. If he can understand something is echoing a lot. Please, over to you.
now this is clear. Am I audible to everyone?
You are audible, but it is echoing a lot. There is some issue on your side. There's a lot of echo. So if you can maybe talk in a slightly lower tone, that may help because we have to move on. Over to you, please.
Okay. Thank you, Dr. Amir. Now it's clear for everyone.
The voice is clear. It is echoing a lot. And again, people say it's not.
Okay. This is a great honor as discussed by Taylor and Dr. Amir
And Dr. Majid, probably, as I said, there are two devices which are on. Check.
Dr. Amir, this is
Yeah, still lot of echo. Still lot of echo. I don't know. There's some tech.
Dr. Majid, if you have two devices in the
Yeah.
same room, please
Yes.
mute one of them.
No,
They are
not
two.
in the same room. But if my colleagues can share my slide, I can just log in from my mobile as well. Please share my slides.
So if you can, Majid, if you want to rejoin, that would be good. And what we do meanwhile, we'll move on in order to save the time. We can ask our previous honorable speakers with certain questions. You want to rejoin? So, ladies and gentlemen, we apologize for this technical hitch, a part of what we are doing globally with so many participants online. But in order to save the time, let's first of all, I would like to ask few questions, and then we move on to Dr. Tahir when he joins back. Dr. Amjad, can you hear me? My question directed to the first honorable speaker.
Yes, Prof. Amir, I can hear you.
Oh, thank you so much. Thank you. Now, from a regional perspective, what are the biggest challenges in outbreak detection, reporting, and response that makes 717 approach more relevant?
Thanks, Prof. Amir, for your great question and to raise this important. As I highlighted during the slides, our region faces a special kind of challenges. Conflict and the fragile system remain the main challenge we are facing. Those kind of fragile system reflected on the surveillance system. Different surveillance system have been applied in different countries. Low capacities in some of the countries, financial crisis and the financial situation prevent countries to invest enough in public health and in surveillance system. Lack of information and sharing information challenges due to some political issue, also hinder implementation of 717 or early detection of some diseases. All of those resulted in recurrence of outbreaks, many outbreaks occurring at the same time, which led to collapse of the already fragile system in some countries. High turnover also played big role on that. So it's a big number of factors. WHO is doing the best to support member state to improve the current situation. And given those situation, I think 717 can provide another scope of support to the countries to improve the detection, notification, and the response aspect. Over to you, Prof. Ahmed.
Well, thank you so much. That's very kind of you for elaborating that. But meanwhile, Dr. Majid has joined back, and over to you, Dr. Majid, and wish you best of luck this time.
Thank you very much, Dr. Amar. Now the voice is clear? Oh, thank you very
Yeah,
much.
it's clear now. Thank you.
Can you please share my slides? It would be great if you can share my slide here. Oh, thank you very much. Thank you very much, colleagues from EMR region. And Infinite, this is an honor to have an opportunity to share the journey and progress of 717 implementation in Pakistan, and how this approach shaping our national and provincial health security efforts. Next, please. Pakistan has officially adopted 717 approach as a part of epidemic preparedness and response in 2023, and the continued coordination with resolve to save life for the way forward and its implementation. The strategic adaptation of Pakistan was strengthened through the leadership of NIH, National Institute of Health, that is also designated at National Public Health Institute of Pakistan. And also we decided to start pilot in one province, Khyber Pakhtunkhwa of Pakistan. Usually in Pakistan, the new systems or approaches, adaptation and implementation process require a lot of efforts in collaboration among national and international institutions, and also provincial governments, development partners, for the creating ownership within that system. So we requested to resolve to save life and 717 Alliance for their technical support and the training, and also the capacity building of our national and provincial staff to review the outbreaks with the toolkit of 717. Next slide, please. The adaptation process of 717 in Pakistan was started with the achieving consensus on 717 implementation in Pakistan, which required year-long efforts with the sustained advocacy, consultation, and technical workshops. A couple of experts from National Institute of Health were engaged at national and provincial forums during the formal and informal discussions with the experts of FETP and public health emergency management specialists and rapid response teams, along with the One Health stakeholders. Although initially some of the stakeholders have some fears that 717 approach might duplicate our IDSR efforts or may have some replacement PHUC and RRT SOPs, but these concerns were addressed through detailed training, practical demonstration of the 717 toolkit, and also highlighted the feasibility of 717 metrics and its importance to integrate within the existing system. And September 2024, we organized a national workshop where we achieved where we floated the idea to the stakeholder, and a consensus was developed to bring the all stakeholders together for its orientation and the capacity building. The stakeholder mostly include the national and the provincial development partners, the government officials, including FETP alumni, public health emergency management fellows, rapid response team members, and the One Health expert across the all provinces. Next slide, please. Resolve to Save Lives supported Pakistan by providing training and capacity building and strengthening our learning through online and the virtual seminars and webinars. And one, as I have discussed, one of our province, Khyber Pakhtunkhwa, offered support for the pilot adaptation of 717 in Pakistan. And we also engage with the different partners, including UKHSA. UKHSA also willing to support the workshops embedding the approach of 717 with community-based surveillance in one district of Khyber Pakhtunkhwa province. Then we decided at national level to review our past outbreak retrospectively. And this retrospective analysis was performed by the frontline workers, including FETP workforce, rapid response team workforce, and public health emergency management specialists who are working at national and the provincial PHUCs. This retrospective analysis highlighted the absence of a standardized outbreak investigation form to capture all the 717 indicator in our previous disease outbreak investigations. In response to the finding of that two workshops, and a standardized outbreak investigation and response tool was developed in May 2025, and it was harmonized with the provincial inputs and the inputs from the partner and development organizations. These standardized tools and the forms were then officially shared to the all provinces and respective organizations for the utilization for each outbreak or the public health event investigation and response. And the same has now already been integrated with our DHIS2 system and its digital access is available for our frontline responders. Next slide, please. Along with this success, we have some challenges, and as some of people might have idea, Pakistan has a devolved structure of the government, and due to the provincial autonomy, we have to work on more advocacy and consultation with all the provinces.
Dr. Majid,
provincial level
we lost you probably. Yeah, we can hear you now.
Okay, thank you. So due to provincial autonomy, we have to work more on provincial consultation with all provinces, decision makers, and which is still challenge due to in the situation of changing the leadership of the province or the health directorate of the province or the region. And due to other competing priorities at national and the provincial level, lack of dedicated domestic funding also restricting our implementation process. We are also trying to secure the long-term sustainability, but the challenges as public health sector financing has no clear support for its implementation at local level. Moreover, the partner have also their own existing plans and activities which required continued advocacy and external partner support to ensure the ownership and the continuity. Next slide, please. So as there are some challenges, but at the same time, we have several enabling factors which are facilitating our 717 implementation in Pakistan. The FETP workforce that is playing as a backbone of 717 implementation in Pakistan and providing technical expertise training, while existing surveillance system also offered flexibility for integration of the 717 indicators within DHIS2 system. We tried to sustain our advocacy to build the trust among stakeholders, which reduce the resistance from the partners and the other organization. The NEH leadership combined with the provincial collaboration anchor the process of nationally and with the top-down and bottom-up approach, we are implementing the 7 and 7 metrics in Pakistan. We have some best practices, including we have updated our outbreak investigation and response tools by integrating 7 and 7 approach, and also integrated the same tool with DHIS2 for online access. We have developed the disease-specific plan with the approach of 7 on 7 response actions, and also integrating the 7 on 7 approach with our rapid response teams SOPs. The next slide, please.
Dr.
This is
Majid, Dr. Majid, thank you, sir. You have 2 more minutes, and then we definitely come toward the question and answer side. Thank you.
Yeah, just concluding. Thank you very much, Dr. Amar. Just concluding now. Pakistan can build 7 and 7 experience to expand the implementation across additional provinces, responding to requests from the provincial governments and countries actively seeking both domestic and international support to accelerate the progress as strengthening domestic fencing streams. But although this is a big challenge for us at national and provincial level as well, but we are trying to
Dr.
have their
Majid, there seems
own.
to, yeah, thank you. You're back.
Okay. So just concluding that with the domestic sport and also looking for the pandemic fund sport, we are going to implement the 7 and 7 in Pakistan, most probably within a couple of years. Over to Dr. Amar.
Thank you so much, Dr. Majid. And I think we feel sorry. I mean, there's been certain problems, technical problem on your side, but thank you so much for that presentation. And it's very encouraging to see the partners joining hands with 7 and 7. And that's a good success indicator for 7 months and 7 and Tyler to take it back to other countries as well. So thank you so much. And we're coming back, ladies and gentlemen. Want to save time, I'll move on with a question for Dr. Dalia. Dr. Dalia, are you ready?
I'm here, yes.
Yeah, thank you so much. Now, the question is, how can 717 data help countries identify priority gaps for pandemic fund proposal, especially in the areas like surveillance, workforce, and rapid response?
Thank you, Dr. Amir. Maybe just to highlight that the strategic or the priority areas for the pandemic fund are really surveillance, workforce, and laboratory. But at the same time, we're focusing also on other underlying themes, which are One Health, community engagement, health equity, etc. And it's very important also to see that there is the level of multi-sectoral coordination coming within the same country, but also in the situation where we have multi-country proposals, then also the multi-sectoral coordination or multi-country coordination is coming very clear. As I mentioned at the beginning, the pandemic fund, the reason why it was put in place, because everybody realized based on the COVID that preparedness is very expensive. But it's very cheap if we invest on it early on. And that's why, given the fact that there was, and still, of course, there is a great appetite to invest on preparedness, the pandemic fund was put in place as a funding scheme that would support the low and middle income countries in building their capacity for preparedness. But the Pandemic Fund is a fund in place, and usually for donors, they would like to see results, whether there is an actual impact of the fund in making a change and in making improvement in the preparedness capacities. If they don't see this impact is coming or progress is made, that would bring a very big question mark on why do we need the Pandemic Fund to continue to be in place, right? Now, the problem is that because we're focusing on preparedness capacities, and again, the data that usually are available that will be coming from the state party annual reporting of the IHR or the joint external evaluation, but also because we're focusing on One Health perspective. So we are using also other tools like the Performance Veterinary Services that is governed by the World Organization for Animal Health and other tools, of course. Now, the point here is that with these great tools, you can barely see a change when it comes to the indicators. Yeah. And when you look into the progress over years, when it comes to IHR and PVS, you will find more or less same level of progress across countries with barely you can see an improvement. That does not mean that there is no actual improvement on the ground. The problem with the indicators related to IHR is that each indicator, it looks into so many different capabilities. And to make the change in these capabilities, it takes time by default. The 717 is a quick tool that is really focusing on specific elements where you can see not only a progress in terms of qualitative aspects, but also it tells you in real figures how much time did it take you to early detect, notify or report and initiate the response actions related to a disease outbreak. So it's, and we understand that any tool in the whole world has its own limitations, yeah? And same with the 717, some of the countries will be saying that we're a very small country and we will need much less time than the 7 days, 1 day and 7 days. Other countries that basically go through a federal system, they might need very long time. The point is not about the exact 717. It's about having a handy tool that would be able to help you to bring the different sectors together to make a quick assessment of the progress and reporting this progress in a way that for the Pandemic Fund, it helped to see there is an actual progress on the ground. Sorry for the long answer. Yeah, back to you.
Oh, thank you so much. That was very comprehensive. Now, coming to Dr. Tyler again, my question, because I see a number of questions pertaining to veterinary side as well. How can 717 link with FETPs, One Health, cross-border preparedness, and humanitarian settings? Over to you, Dr. Tyler.
Absolutely, they're all great questions. And I will say this is another area where we have sort of a growing body of evidence. I think the early use cases that we had around 717 were primarily human health, infectious disease outbreaks in more or less stable environments. But as we continue to grow and scale and work with a diverse range of countries and sectors, we're continuing to grow the evidence around that. I think maybe speaking specifically to animal health and One Health, we're really seeing a lot of progress. Early on, we first started having sort of assessments of 717 that were for zoonotic origins of diseases, but it wasn't until after it had made the jump to infecting humans that 717 was being assessed. Now we are starting to have some really strong use cases, especially out of Southeast Asia, where 717 is being applied directly to the animal health sector. We actually have in Thailand right now, they're sort of doing a review of zoonotic outbreaks where they're applying 717 to the animal health sector and separately to the human health sector. And then the two sectors are working together to compare the results that they saw sort of on both sides to see where there are opportunities to sort of invest and strengthen sort of their coordination between sectors. We're also seeing this sort of extend to the environmental health sector, which is a newer area for us. And so we're eager to see how that tests the guardrails around 717. And I think you mentioned humanitarian context as well. Like we're working in a diverse range of settings from like centralized countries to federalized structures to large countries like the Democratic Republic of the Congo and also small island states like Vanuatu in the Pacific. So it's really proven to be quite flexible. We have not yet been implementing this in an ongoing significant humanitarian crisis, but there is demand for that. And so that's where we're keen to work with experts in this region and elsewhere who can help us to think through how best to streamline our tools and our adoption process to make sure that that what we're doing adds value, doesn't take away other critical resources, and is additive and supportive in the realities of the context in which we're looking to implement.
Thank you. I think that must satisfy, because as I see lot many FETPs online, so I'm surely, you already pointed out the champions. FETPs have been the soldiers on the ground during the pandemic time, and surely they'll move on for 717 very actively and effectively. Now, coming to our last speaker, Dr. Majid, what bottlenecks or systemic gap did the 717 framework help identify in Pakistan's health system? Over to you, please.
Thank you very much, Dr. Amar. This is a really great question. And as we are operationalizing the 717 approach, and we have recently assessed the retrospectively and prospectively approximately 16 outbreak in Khyber Pakhtunkhwa province, Pakistan. And we have identified the major bottlenecks in the field of detection. As the IDSR system is not capturing all the cases, and that could be detected within the that could have ability to detect the outbreaks within 7 days. Similarly, we have some challenges in identifying the relevant partners and the stakeholders for responding to the outbreaks effectively in the local level by coordinating with the animal health and other local health agencies who are supposed to provide the effective response at the local level. So along with many other, these are the most frequently reported bottlenecks, and also some opportunities as we have initially realized, this is the enabler, we have initially realized we do not have standardized outbreak investigation and response form. So by the consultation with all provinces and the region, now we have developed that one, and all the outbreaks from the KB province are being reported on that form and integrated with DHIS2 as well.
Right.
Over, Dr.
Right. Thank you so much, Dr. Majid. Now, coming back to the audience, a good number of participants have requested for the slides. Definitely, after getting the permissions, I would request the administration to share the PDF version. That is one of the main requisites from your side. But Mr. Khwaja Mir Islam is asking a question: what is the impact of using 717 approach as monitoring framework for pandemic fund? Dr. Dalia, can you reply to this question?
Yes, and I think I feel like I'll be somehow repeating what I said. I mean, again, the pandemic fund is a tool that was put in place to enhance preparedness. So we need to see results. The results framework that we have includes very specific indicator related to how many countries are actually utilizing the 717 to measure progress. But at the same time, because we know that each country or each project will have its own specificities, and therefore we have developed the monitoring and evaluation, which is a project-specific results framework. And this includes a number of indicators related to activities, related to inputs, outputs, outcomes, impact, etc. And it gives the countries that are awarded by the pandemic fund a varied number of indicators that they can select from in order to measure progress. And this exactly comes in line with the 717, because you will find so many different indicators related to surveillance, but not surveillance as a big picture. I mean, if you go deep down into the elements related to surveillance, the elements related to workforce, laboratory, etc., this is where you can find it. I think just one important element that I would like to add here is that the pandemic fund, the way we are supporting countries is, as mentioned earlier, single country proposals, multi-country proposals, and regional entities. And therefore, so it's not only the 717 can be utilized to measure progress related to specific capacities, think the other results area related to the coordination, related to financing, related to efficiency can also be indirectly supported by the 717, because we know that the problems related to the early detection and response, its capacities at the first place, but there are also other things related to enabling environments. And this can be easily tackled when you are bringing the different sectors together to look into the disease outbreaks, why things are happening that way, what are the main problems, bottlenecks, and can easily link it to the resulting framework and show progress towards where the money should be going in the future and making decisions accordingly. Thank you.
Thank you. Thank you so much. Dr. Yusuf Khader has a question, and a similar question has been asked by Mr. Hisham Akhtar as well. Tyler, it's for you. In your experience, what are the most effective mechanisms to ensure that signals from the animal health and environment surveillance are rapidly integrated into the national early warning system so that the detection and response occurs within 24 to 48 hours window envisioned by 717 approach? Already a little bit of has been said, but over to you for slightly more details.
Yeah, absolutely. And I think there's not a one size fits all approach on this for all countries, because the type of surveillance systems and the degree to, and how they're implemented and how sensitive they are often varies a lot from country to country. I think the most important thing is that we implement 717 in a way that is integrated into the existing programs, that it is sort of consistently applied, and that there's sort of clarity from everyone involved in the sort of surveillance and reporting processes to understand what are sort of the criteria that sort of it allows us to move forward with a 717 system. And by that, what I mean is, so 717 should not replace any existing sort of surveillance mechanisms. It's integrated alongside, but not intended to replace. What we do have a question around a lot is when we have like event-based surveillance systems that are extremely sensitive and we have signals that are coming up, hundreds to thousands per week. Like, obviously, we're not conducting 717 assessment. So making sure that everyone's on the same page about sort of what the priorities of the government are, and what are the thresholds that need to be met that would sort of trigger a 717 to occur. Usually it's sort of, if a response is activated or the EOC is activated, something like that, that would be sort of when you sort of conduct a full 717 assessment. But integrating the 717 itself should not cause sort of significant changes to protocols or existing programs or requirements of your existing sort of surveillance systems or processes. It's merely additive at a higher level, at a systemic level, to look across surveillance, notification, and response to ensure that everything is continuing to work in a timely manner.
Right. Thank you. I think, Dalia, you are, I think, one of the main targets for questions as I see the box. So the question is, what institutional governance and financing factors limit the Ministry of Health's ownership and leadership within the pandemic fund mechanism?
That's a very interesting question.
Yeah.
Okay, let me quickly take you through the governance framework or the governing body, if you want, or structure for the pandemic fund. The governing body that we have basically includes 3 types of seats: voting members, non-voting members, and observers. And when it comes to the decision making, and particularly when there is a need to vote, it's mainly the voting members. The voting members at the moment, they are balanced between those who are putting the money, which are the contributors, and those who are receiving the money, which are the countries that are benefiting from the pandemic fund, the low and middle income countries. So we have 9 seats for contributors, and we have 9 seats for the beneficiaries. And those 9 seats are divided per region in order to make sure that we have all the countries, the 146 or 47 countries, are being represented. So the 9 seats, basically, we have 2 seats for the MENA region, like one seat goes for North Africa, and at the moment this is represented by Egypt as a principal member and Tunisia as an alternate member. We have another seat that is covering the other part of the MENA region, which is at the moment represented by Pakistan, which involves the other countries apart from the North Africa. And so on and so forth. Like we have 3 seats for Africa, 1 seat for the Americas, 1 seat for the European countries, etc. The problem that countries do not understand, and I myself have been really trying to change the paradigm related to this agenda, is that you do have a voice and a word to say when it comes to the pandemic fund related strategic directions and the overall discussion. The problem that we are seeing at the moment, and unfortunately continues to be the same, that those who are representing the other countries on the board, they still are not able to make the continuous engagement with the countries that they are representing. So Egypt to reach out to the North Africa countries, Pakistan to reach out to the other countries to make sure that they are engaged in the different discussion that happens during the governing board related meetings. And again, discussion, it's not only to say that we're going to focus on surveillance or we're going to focus on laboratory, or this year we are allocating 500 and next year we're allocating 300. It's the entire discussion related to the pandemic fund. It's all strategic directions. It's all the priority areas, funding where to go, even the recommendation when it comes to proposals that should be funded during the different rounds. So I'm taking this as an opportunity for Egypt to reach out to the countries in its constituency, Pakistan to reach out to the countries in its constituency. Egypt actually have been really doing great in reaching out to the different members. Pakistan, because there have been a lot of changes in the members themselves that are sitting on the board. But the point I'm trying to make here is that countries, they are actually making a difference, and they need to use this opportunity to make their voices heard when it comes to all issues around the pandemic fund, strategic directions, and anything related to resource mobilization, communication, support to countries, what kind of support, countries to be supported financially, the targeted approaches, etc., etc. We can speak about this for a longer time than what's allocated at the moment. But please take this opportunity to reach out to Egypt and to reach out to Pakistan to understand better how you can be more influential when it comes to your voice as your country. And it's not only health, it's health and finance, because this is how we encourage the coordination between the different sectors. Back to you.
Right. Thank you so much. May I ask Miral, how much of time is left with us? Miral?
Yes, sorry. Well, we do have 3 minutes left.
Yeah, 3 minutes. That's what I understand. I think there are so many questions. We will try to get back to the audience with replies for that. But I think most of the questions are quite overlapping, as I see. And I think as it's the closing time, I would like to conclude today's session. Let me reflect on a few takeaways that's very important for the audience. The 717 approach offers a powerful yet practical framework to strengthen timeliness and accountability in our outbreak response. And these 2 things, timeliness and accountability, I think play the major role once we move on with the outbreaks and epidemics, and God forbid, any future eventuality. We have heard valuable country experience and lessons in Pakistan, underscoring both challenges and opportunities in adopting this model. Importantly, 717 is not a standalone concept. It is a highly complementary to existing global health security framework, investments, One Health, and other possibilities. And that's I think, the familiarity, much more familiarity as you move along. The more clarity you get, the more utilization would be there. I would like to sincerely thank all our expert panelists, all 4 of them, for their insightful contribution. Thank you so much once again. A special thank goes to AmpNet and 717 Alliance. And here I would like to say a few words about the leadership, Dr. Muhammad Al-Nasur at AmpNet, and Tom Frieden at 717 with his team. I think you people are doing an amazing job. And thank you so much for organizing and supporting today's event. And in particular, a huge thank and indebtedness to our participants for your active engagement. My special gratitude to Dr. Salma Hafifi for making it possible throughout. It's been quite busy these days, along with the team, including Miral, Sayed Himad, and others who have been supporting us. So thank you so much for all your hard work and your work behind the cameras. Now, ladies and gentlemen, let us continue working together to build faster, smarter, and more resilient outbreak detection and response system across the Eastern Mediterranean region. And with that, definitely, I would like to say goodbye and thanks to all the audience. Again, good morning, good afternoon, good evening, wherever you are. Have a lovely day. Thank you so much to everyone.
Thank you. Bye-bye.
Thank you, everyone.
Thank you.